So here we have David actually recovering that same dog. He still got his, well, unfortunately, sometimes when they're under anesthesia, they lose control of their bowels. It's just a less glamorous part of the job. But the important part that I wanted to point out is that the tube that controls the airway is still in place. So it's David's job, and an extremely important job actually, to make sure that when this dog starts waking up, that he pulls that tube out of the trachea to make sure the dog does not either choke on the tube or bite off part of the tube, which would be a medical disaster. So as soon as the dog starts recovering and there's certain signs of it recovering, regaining jaw tone, moving, those types of things, David will go ahead and pull that tube out and allow the dog to breathe on its own. He's checking gum color, he's checking a lot of separate different things here before he does that. So recovery is just as important as the surgery. He's untied the tube just in the preparation of pulling it quickly, because when they come around, sometimes they come around really quickly. And if you've ever lost a tube, as we call it, you learn to be very, very cautious. So he'll sit with this dog for a while until the gas anesthesia wears off, and then he'll pull the tube. He's asking for a syringe now because you actually have a cuff on these endotracheal tubes. It's like a balloon at the end that helps seal the airway so that you have complete control and no leakage of gas out, and the oxygen's actually making it into the lungs. And it's another important part to deflate that cuff before you try to pull it, because you can cause some damage essentially. So again, a benefit of using the gas as opposed to some of the injectable or intravenous anesthetics is that basically the gas wears off really quickly, so they're not under as long. They have less of a hangover effect, less of a less side effects in general, so they usually come around pretty quickly here. He'll be up here in just